Good evening, everybody, and welcome to Monday night's sponsored webinar. Tonight's webinar is proudly brought to you by Breathe Easy, and we would really like to thank them for their sponsorship of tonight. It's going to be a fascinating talk. I have seen some of the slides beforehand, and I have listened to our speaker, Phil Padgett, before, and you are in for a treat.
Well, thank you so much for the lovely introduction. It's a pleasure to be with you this evening, and I want to start by thanking everyone who's tuned in for the talk tonight. We're going to talk about canine inflammatory airway disease, more specifically about the diagnosis and the treatment. When we think about taking care of patients with non-infectious airway disease, we typically consider corticosteroids as one of the mainstays of therapy. In a moment, I'm going to talk about a little more about why that actually is so appropriate, more specifically to the respiratory system than others. But I think we can all agree that in the dog especially, chronic use of corticosteroids has a whole number of potential side effects when given systemically by oral or the or the intramuscular subcutaneous route. And we're pretty aware that dogs given steroids chronically have a tendency to have behavioral changes, which may or may not be directly related to increased hunger and thirst. They certainly do drink more. They certainly do eat more. They certainly do gain weight. They're more likely to have propensity for skin and urinary tract infections. And again, because of the effect of steroids on insulin sensitivity, their serum glucose certainly can go up. So those are long-term concerns we've had with the use of corticosteroids in dogs for as many years as we've been practicing. Any condition in the respiratory system that is amenable to steroids, any disease from the nose to the trachea for which you would consider using systemic steroids, is a disease we can consider using inhaled corticosteroids. And we'll discuss in a minute why that's true and why that's advantageous. 2 points to make as we start. The first is, as we go through each of the disorders in the respiratory tract, we'll wait till the end of the lecture to talk about the specific doses of drugs to be used, if that's okay. And the second is that typically in a talk like this, it's fun to use videos to demonstrate the disorders we're actually talking about. But by the nature of a webinar and the fallibility of using an internet connection, we won't be using videos just this evening. When you think about the respiratory tract and you actually start from the tip of the nose and go to the lung, you can consider common diseases that we see in the nasal cavity would be chronic non-infectious rhinitis. If you move back into the throat, the posterior pharynx, we see dogs that have what we call reverse sneeze. And if you'll forgive me, when we get to some of these disorders, I'm going to try to mimic the sounds that are made, so please allow me to do that. When we get to the larynx, one of the common diseases, of course, that we see is laryngeal paralysis. When we get to the trachea, a common disorder we see is tracheal collapse. When we get down to the bronchi, one of the most common reasons for dogs to cough as they get a little bit older is the disease called chronic bronchitis. And finally, the one condition we won't speak of tonight, but which is completely amenable to inhaled steroids, we typically call eosinophilic pneumonia or some variation off of that. If you stop for a second to think, well, why is the respiratory tract so specifically amenable to corticosteroids and then inhaled corticosteroids compared to other organ systems? The answer is pretty straightforward. The respiratory system is lined from beginning to the distal terminal bronchioles with mucosa. And the function of the mucosa, of course,